Imagine a world where cities are not just concrete jungles, but thriving hubs of health and opportunity for everyone. That's the vision the World Health Organization, WHO, is championing, but achieving it requires a radical shift in how we approach urban planning and development. On World Cities Day, the WHO issued a powerful call to action. National and city leaders must transform urban areas into powerhouses of health, equity, and sustainability. With over half of humanity, a staggering 4.4 billion people, now residing in cities, and projections soaring to nearly 70% by 2050, the stakes have never been higher. Cities are where health, inequality, environmental concerns, and economic realities collide, creating both immense challenges and unprecedented opportunities. While every urban environment faces its share of health risks, the most devastating consequences are disproportionately concentrated in slums and informal settlements. Residents of these areas often endure unsafe housing, inadequate sanitation, food insecurity, and escalating exposure to floods and extreme heat. Currently, a staggering 1.1 billion people live in these conditions, and chillingly, that number is expected to triple by 2050 unless significant action is taken. To address this critical need, the WHO has launched a groundbreaking guide for decision-makers titled, Taking a Strategic Approach to Urban Health. This guide provides concrete strategies to usher in a new era of urban health action, responding to the growing demand for integrated solutions that address health challenges and promote well-being in urban settings. It's the first comprehensive framework of its kind, empowering governments to strategically plan for urban health by integrating evidence into policy and practice. This is a moment for decision-makers at every level to act together, emphasized Jeremy Farrar, Assistant Director General for Health Promotion, Disease Prevention and Care at WHO. The guide gives national and municipal leaders, planners, partners, and communities a framework to work together, across sectors and scales, to build fairer, healthier, and more resilient futures. Health risks and inequities are pervasive in urban areas worldwide. For example, a study encompassing 363 cities across 9 Latin American countries revealed shocking life expectancy gaps of up to 14 years for men and 8 years for women between the healthiest and least healthy cities. But here's where it gets controversial. Is this solely a matter of socioeconomic disparity? Or are there deeper systemic issues at play in urban planning that exacerbate these differences? Urban residents everywhere face multiple, interconnected risks, from the insidious effects of air pollution and the dangers of unsafe transportation to the health hazards of poor housing, excessive noise, and the escalating threats posed by climate change. Air pollution alone claims approximately 7 million lives annually, and alarmingly, nearly every city dweller breathes air that fails to meet WHO air quality guideline values. Densely populated urban environments also heighten the risk of infectious disease outbreaks, such as COVID-19 and dengue fever. Furthermore, limited access to green spaces increases the risk of non-communicable diseases like heart disease, diabetes, and some cancers. Urban environments have become the dominant influence on human health, while also driving global challenges such as climate change, resource scarcity, and growing inequality. This positions them not only as the front lines for today's health challenges, but also as the greatest potential source for transformative change. Strategic action on urban health holds the key to fostering equity and creating resilient, attractive urban environments that are conducive to economic development, environmental sustainability, and improved quality of life. People and businesses are increasingly gravitating towards environments that offer safety, livability, and opportunity. A powerful example of decision-makers bringing community voices directly into urban design for health can be seen in various locations, including the Dandora neighborhood of Nairobi, Kenya, Suva, Fiji, Makassar, Indonesia, and Coimbra, Portugal, among others. Cities are key to advancing public health, stated Dr. Etienne Krug, Director of Health Determinants, Prevention and Promotion. This guide offers governments a roadmap to act strategically, making operational links with other major global policy issues like climate change, transport, digital transformation, and migration. The guide emphasizes that health is not the sole responsibility of any single sector, nor is it limited to the decisions of city officials. From ensuring clean air and safe housing to promoting active mobility and digital access, and encompassing broader financing and regulatory actions, the everyday decisions made by urban authorities across multiple sectors and scales significantly impact the health of billions. Taking strategic action means aligning these choices to build healthier and fairer futures, where urban systems work in harmony to advance equity, sustainability, and resilience. And this is the part most people miss. It's not just about individual actions. It's about systemic change and coordinated efforts across all levels of government and society. Taking a strategic approach to urban health outlines practical steps for governments to understand the complexity of urban systems and how they shape health and equity. Identify entry points for action, recognizing opportunities to build urban health across policy and practice agendas in other sectors and issues. Strengthen the means of implementation for urban health, including governance, financing, data, analytics, innovation, capacity strengthening, partnerships, and participation. Develop comprehensive urban health strategies at both national and city levels. The WHO urges municipal and national leaders to adopt a more strategic approach to urban health, recognizing the crucial role that local and national governments play in creating coherent health action that aligns with other societal goals. This will transform urban areas into spaces that are not only more livable but also more just and sustainable. Alongside the guide, the WHO is launching the first 3 modules of an urban health e-learning course, hosted by the WHO Academy, to strengthen capacities for collaborative work in urban contexts. Developed with input from a wide range of global experts, taking a strategic approach to urban health. A guide for decision-makers builds on decades of WHO's work on urban health, demonstrating that when health is tackled in a strategic way, it can drive healthier, more resilient societies. What are your thoughts? Do you believe that cities can truly be transformed into engines of health and equity? What specific actions do you think are most crucial for achieving this vision? Share your opinions and contribute to the discussion below.